About 20.2 million people in the United States have substance use disorder, and about 8 million of those 20 million also suffer from mental illness. 45% of people suffering with substance use disorder have a co-occurring mental illness condition. Staggering facts, aren't they? Clearly, these two challenges have intertwined underlying causes such as genetics, trauma, or other social economic conditions that leave people susceptible. In this episode of Warriors of Hope, I set out to explore what is substance use disorder and how it correlates to mental illness. What are the clinical barriers to overcome it, and what is needed to sustain and manage recovery through lifetime? As I researched the prevalence of both in Central Texas community, I came across Integral Care. Integral Care provides services including outpatient care, counseling, prevention education, peer support, and medications that reduce withdrawal symptoms and cravings to the community resources. I set out to visit with members of Integral Care team to learn more.
Well, I've always been interested in helping underserved populations, and stigma within mental health often ends up being a barrier to people getting the help that they need. And that stigma in substance use disorders is even greater. The other thing that a lot of people don't realize is that with substance use disorders, recovery is possible and treatment is effective. People may feel like they're at their worst or at their rock bottom, and there's actually tremendous resilience and potential for recovery. At Integral Care, we estimate about 60% of our clients are trying to recover from both a substance use disorder and a mental health condition. And both mental health and substance use disorders share some common underlying causes, which include genetics, exposure to stress and trauma. And you'll see that some people use alcohol or other drugs to cope with mental health symptoms like depression, anxiety, insomnia. And then there are other people who overuse alcohol or other substances and find themselves developing symptoms of a mental health disorder, which also include depression and anxiety, as well as psychosis. Substance use disorder is a brain-based disorder in which chronic substance use can lead to alterations in the brain. It's important to know that it's not a moral failing and it's not a character flaw. It's a brain-based disorder that can improve with treatment and that recovery is possible.
Conversation with Dr. Wen was very helpful for me. I learned that substance use disorder, much like mental illness, is also a brain-based disorder, not a moral failing. It is also a condition that requires an intricate infrastructure of support and sustenance to prevent relapse. For it is not about the one-time fix, but a lifetime management that ensures a patient can overcome and thrive. That got me intrigued to learn about what it is like to walk through this journey, a personal experience of walking this path, overcoming the struggles, fighting the failures, the relapses, and then integrating support into the life as it is. I got an opportunity to meet Felicia, a substance use and mental health survivor, someone who has lived this path to recovery and sustenance.
Okay, so I suffered with mental illness and addiction. I'm bipolar, and I was really addicted to heroin, and I was on the streets for about 15 years. I had started running away when I was 14 and just got stuck in the lifestyle. And throughout my childhood, I was in and out of foster care, and I just didn't really have didn't have anybody to really teach me how to be an adult. So being on the streets is just where I ended up. And I always tried to fit in. I didn't really have friends growing up or anything. So when I went to the streets, that's where I finally felt like I kind of related to people and started making friends out there, but of course all of the wrong ones. And I got so far in the lifestyle, I just didn't know how to change. I didn't know how to get off the streets. A few years ago, I had another daughter, and I was able to get clean for about 3 years, being on methadone, and then everything just fell apart. I got off of methadone thinking I can do it on my own, and I got back on heroin, and went back to the streets, and I lost my daughter. And
how old was she when you lost her?
3 years old. And I went through CPS battle for about 2.5 years, or a year and a half, sorry. And I just couldn't get it together. I didn't have the kind of support that I needed. I'd gone to rehab, but I just didn't commit to anything, and I didn't have enough support really to get it. So I ended up back on the streets. I lost her, and during the battle with CPS, I kept going in and out of rehab, but just nothing really stuck. And then on December 26th, 2016, I ended up signing my rights away and lost her completely. And that's when my addiction just nosedived even harder. It was a painful time. Then exactly 6 months after that, I got pregnant with, again, and I didn't know at the time it was twins. But when I found out I was pregnant, I was like, yeah, this has got to change. I can't do this again. I do not want to lose another child. And so that's when I got into the methadone clinic. And this time I vowed to do whatever it was going to take to get it right this time. And so I got into the methadone clinic, and I really, really just worked as hard as I could to do whatever I could to make it work.
What a story. Story of resilience of a mother fighting to make a better future for her kids. Story of resilience of a woman who's not afraid to fight for a more hopeful future and go back at it over and over again despite any setbacks life might bring her way. And what a testament to programs such as those offered by Integral Care and City of Austin that provide for people like Felicia access to healthcare, access to treatment, to medications, to counseling, to peer support. Yet more must be done. More must be done because the stats are staggering and the stats are growing. As I set out to learn more about the substance use disorder and how it overlaps with mental illness, I learned about the clinical programmatic elements that must be put in place to provide effective treatment and to reduce the rate of relapse. However, I continue to ponder that there have to be other infrastructural, other policy, advocacy, and community resources that have to come together so we can have a more focused approach, a more elaborate approach in tackling this epidemic of substance use and mental health in our communities. Join me as I continue this exploration in the part 2 of this episode series, where I will visit with other community leaders such as Integral Care Foundation. I visit with City Council members to learn more about their take on how people like you and I can lend our voice, our time, our resources to be part of change, to make an impact and to tackle this problem of substance use and mental health. Until next time, thank you. Join me as I travel the world in meeting the warriors of hope, in telling their stories, in forming collaborations and service projects that aim to make a tangible impact towards their missions. For I strongly believe together we're stronger. Follow me on YouTube, on Facebook, and IGTV. Have a blessed one.